So see, there are a couple of issues here. One is the fact that you seem to be having some excess here. But secondarily, also your lower third facial height is less. The dorsal aesthetic lines have been made more feminine, curved, nice tip. So you had a buccal pad fat removal in 2020.
Mm-hmm. And rhinoplasty.
In 2020 as well.
Yes.
Botox for masseter. All right. So you had a few procedures. Okay, can I see your ears? Right. The angle is fine now.
Mm-hmm. But I don't want to continue doing. This was just.
So see, there are a couple of issues here. One is the fact that you seem to be having some excess here. But secondarily, also your lower third facial height is less, width is more, and this also is low. So that's why you have a convex profile when you see on the side. So it's a combination of upper jaw issue and lower jaw issue. Upper jaw issue is more evident as far as you are concerned. If I look at you, I would look more that
More
the chin
to the-
is
yes.
the one that is. I mean, it just is
You
depends on
see
people.
golden ratios. I
Yeah.
don't.
Yeah, and also when you smile, you have a little bit of a gummy smile there. That's a little bit protrusive. Okay. Now, if you want, and you can see here, this is a classical. We call it bimaxillary protrusion.
Sure.
We also have a very short lower third face and even the lower jaw. Now, to correct everything, there are two options. One, I take this thing that's come forward back, and this goes back along with it. Why? Because unless I take both the front and the lower jaw, only the teeth part back, then only your problem will be solved. There is a problem with that though, not technically, but aesthetically. What is it? You're in your mid 30s, and if I do that, what will happen? Everything gets a little loose. Skin, muscle, all the complex get loose. So what will happen? Even though you'll not have the protrusion, even though you'll have a nicer profile, you'll end up looking a little older because the bone support is not there. So hence that's not a good option. If you were in your teens, 18, 19, 17, that would have been the best bet for you in the first place. But they've done orthodontics for you then, I don't know, they say 15 years ago. So,
Yeah, yeah.
but hasn't been solved. Hence, I would not advise that way of solving your problem now. So, what is the second option? The second option is I do not take your jaw backwards, but I just rotate it.
Right.
So, I do a counterclockwise rotation of your upper jaw, meaning what is outside sticking out will be rotated like this.
True.
Then the lower jaw will be brought forwards and outwards. So you will get length here, you will get projection here, and this will go in. So that will be giving you some amount of balance to your facial thing. But what will happen with that? Your face will look longer and your face will look bigger than now. So that's not the flip side. That's something I like, but people have to like also because you're a woman and your stature, you're not very tall. If you're like 5'7", 5'10", like tall, this is absolutely the go-to procedure. But since you're not so tall, then I have had people who are like, sir, मेरा चेहरा तो अब मेरे शरीर से बड़ा लग रहा है types. Can look like that then. I'm just trying to tell you what are the options. These are two options only available for you. The third option is there, a smaller option than both these options. I'll only do a small chin for you and try to match with this protrusion here so that when someone looks at you, this is not so visible because this is also come forward. And we can do a nose again if you want and break the nose a little bit more prominent. So, and that is the best way going forward as far as you're concerned because you're not going to get younger. And in the next 10 years, when there's more laxity of skin and everything, this will help you.
Right.
So these are the three options that I can think of in your case. The first will be not an option to consider because you'll have, second is okay, but again, not so good because of your height and because of everything else. The third is a simpler option. It won't solve everything. It's more of a camouflage option.
Yeah.
But probably you could try that out. And If you're happy with that, then you wouldn't need to do anything else. If not, you can go back and do the option 2 after 6 months. That option 2 is open for you, even later on.
Even after the.
Yeah, sure. Even after do the chin, you can still go and do the rotation option of the upper jaw and all of that. This is before we did a redo rhinoplasty. Patient had already had a nose job done elsewhere. You can see how we've refined it. So the dorsal aesthetic lines have been made more feminine, curved, nice tip. The upturned nose has been made to look down. So that looks more feminine, more proportional. We'll now show you the side view. And you can see how that nose was upturned. And now we've given it a much better proportion to that nose. And you can see the improvement. I'm going to show you both the before and after. Focus it separately. And you can see the improvement. You can see at the front view as well. A nice tip, good projection. And the barrel shape of the nose has been made more hourglass.
Throat pain? So there's a pack inside your nose, so that will come out after 5 days. So it's already now 4 days. So tomorrow it will come down. So it's been now. Yeah. So tomorrow, once we remove the pack, yeah, tomorrow after we operated on 14, right? So today is 3rd day. Tomorrow is 4th day. So day after tomorrow we'll remove the pack and you will be going back to the hotel. And then you'll have to come. Yeah. So on 10th day, we'll remove this. So on 24th. Yeah. Outside one.
And I get to go the 60 to the hotel. 30 to the hotel.
Yeah. Okay?
Yeah. So that's all. It just, the thing is the gauze is stuck up to my throat.
No. It's not the gauze. It's because of the intubation thing, you'll feel like that. There's no gauze inside. So gauze is only kept in your nose. Okay, that's why I will take it out after tomorrow or tomorrow evening. Everything is fine. Okay?
Yeah. And when do I start eating semi-solid?
Semi-solid from day after tomorrow once I remove the pack. Okay?
Yeah. Thank you so much.
Okay.
On the main road on this side, they have, what you have to have is veg thali or thali meals plus fish fry. And there are 2-3 types of fish fries. So you can choose, they can on big plates, you choose what you like. But I think the big pieces are really yum. That's very typical of this plate, as I'm saying, and it's really nice.
You've been asking where to get a good fish because mostly people make fish at home here.
Yeah,
So that
no, but there are some restaurants, and this one is amazing. Currently, it's the best for all this kind of food. And you also get some tapioca, you can use some fish curry. It's nice. You're a little careful, but you can eat.
Yeah, fish is going to be fairly soft. So
Yeah, it's going to be soft.
Compared to that fish is
no, soup. I haven't
soup,
had.
yeah.
Mostly
I have to
soup.
chop
But
all the time.
this place
That's
that we're
it.
staying, Ramraja Regency, yes, most of the patients come there.
What place is this?
Ramraja Regency.
Oh, you're staying there, not nearby.
No, because we've had the best kitchen staff there. They
Oh,
customize
okay.
according to
So
the-
my house is just
Oh, so
like
it's on the same lane?
almost.
No!
Yeah, I know very close.
Is it
Like
the
it's
Jesus
probably-
Castle by any chance? It's right next to.
Yeah, so that castle is there, right?
Yeah.
That's an apartment.
Uh-huh.
So you have to
Get out of
walk.
the lane.
Yeah, it's on that lane. There's a private road there. That's where I live. It's just 2 minutes walk. Hello? Vare. You free? Come over. You can see my place. The thing is, I have a lot of cases today because tomorrow evening we're traveling outside. I told you, right? So I'm not here. So I would it's 12:25. I probably will be at home around 1:30 for half an hour.
Right, we have to be very
No, you.